Well, hi, welcome back, everyone. As you might have saw on the last video, is the sort of title of it. Well, it looked like a series. It's kind of. So it said that most of these anti-opioid people tend to lean pretty far right. I am saying this as a leftist. So the group itself, the Doctor-Patient Forum, it's bipartisan. You will find people in that group across the political spectrum and many walks of life. Now, a lot of people who are not politically active, terminally online, don't tend to hyperfixate on political terminologies and certain things that what you find in the internet world by political commentators and influencers on social media to be very politically divisive. Not everyone is aware of this. I had a conversation with Cassandra not too long ago about that, actually. I've talked to a lady, and I was talking to her about how a particular person that I was interacting in a video game, a particular person I was interacting with was bringing up politics, very right-wing politics. I don't think this person's far right, but a lot of the far-right people within the Republican Party have done a bang-up job brainwashing their voter base. Aside that, the point is eventually the leader of the guild goes on to say, like, hey, because I said I don't have a problem debating politics with people. The issue is that a lot of the times when I debate politics with somebody that thinks that there's a little girl out there that thinks they're a cat that poops in a litter box, generally I tend to have more information than that person and debate way over their head, and they get really upset. So it's like, I'm fine debating as long as everybody stays civil and decent and respectful. It's not a problem to me. It's when people become disrespectful that I have an issue with it. So the guild leader says to me, well, I think we all know that CNN and MSNBC is the left-biased media, and Fox is the right-wing biased media. And I said, you don't watch political stuff on social media, do you? And she said, no. And the thing that people have to understand, that's a very, very large amount of people in the United States, especially in older age brackets. A lot of older age brackets tend to not get any kind of news or information off of social media. They might get it from the internet, but they're going to get it from a news source somewhere, and a lot of these terminally online political pundits tend to be very hyper politicized and very, very divisive. Vosh actually did a video about this not too long ago, talking about how Alexandria Ocasio-Cortez felt that the online left was very, very toxic. Vosh explained that she was right and went into this long explanation. I'll leave a link to a video. You can go and watch that if you want. But honestly, I really liked what he had to say, and I actually agreed with him on that. But, a lot of these online people probably couldn't define what being leftist even means or what it is, or I tend to agree with this sentiment. If you're a leftist and you're worried about white people having dreadlocks, you're worried about the wrong thing. So there's some political divisiveness that's coming up within the Doctor-Patient Forum, which is really bad, because when a grassroots movement like the Doctor-Patient Forum starts becoming politically divided, it tends to hurt the overall cause, which to Carrie, Beverly, and Claudia, I might suggest out there that is a psyop. Like somebody from the DEA or the Department of Justice actually coming into our space and saying those things deliberately to be politically divisive to try to break up the group. Because the Doctor-Patient Forum not only advocates for chronic pain patients, chronically ill patients, disabled patients, elderly patients, they also advocate for harm reduction for people with substance use disorders and access to things that revolve around harm reduction. well, they've been bumping into so-called leftist socialists, and being accused of things that they are not, such as being bought and paid for by Purdue Pharma. That's really insulting when someone suggests that people who, I mean, a large, like chronic pain patients who are debilitated by chronic pain are going to fall into a few categories, but a lot of them are either unemployed with no income, don't even have access to health care, or on disability or retirement. I mean, you're talking about people, a group of people that are living in pretty harsh poverty. And to say that they are being bought and paid for by a pharmaceutical company, you're talking about a group of people that are living in such an impoverished way of life that even if as a leftist, if Purdue Pharma offered money to push these narratives, I think most of them, including myself, even I hate commercialism. I hate the establishment. I hate the machine. But I'm so hurt for money at the current point in time in my life. If Purdue Pharma offered me money, I think I would take it just to survive. But that's not the reality. That's not what's actually happening. That's not the case at all. This is one of the reasons why we keep shouting, is because we want media attention. We want full able-bodied people to pay attention, because picking on a group of people that are disabled, that's a really vulnerable group to pick on. You know, you're talking about people that struggle to bathe and put on clothes and get out of bed, let alone be able to go up to Washington and do a million-man march. You know, this is not... This is really hard on this community. Like, you're picking on some pretty vulnerable people here. Like, pretty much all we have is to try to scream at the top of our lungs and hope someone pays attention. So having full able-bodied people in our corner is a very good idea, because those full able-bodied people are able to do things physically that we can't do. Anyway, so then this concept of is this whole push for pro-opioid medication, is that left-wing or right-wing? And I wish I had a screenshot. It was such a very, very, very long conversation. I might have one. Hold on, let me see if I have it. Try to, you know, I don't. That was a very long conversation between Carrie and I. So I don't know, that very, very, very long. But I wish I could show the exact screenshot of. Basically, it was somebody saying something along the lines of, they are tired of seeing all these white people complaining. And my response to that is this, of like, look, of course we recognize. So on behalf of the Doctor Patient Forum, I would say, of course we recognize that Black people are disabled, that the people of color in general, not just Black people, but people of color in general, people of color, LGBTQ plus people, women. Of course we recognize that these groups of people can be chronic pain, chronically ill, disabled, and elderly patients, or have a substance use disorder that they wish to treat with harm reduction. Of course we recognize that. I mean, people exist. When we talk about chronic pain, no one has specified only white people, only white women. Nobody has done this, and no one should. This is literally for anyone, regardless of your creed, regardless if you are a trans woman, if you are a cis woman, if you are a man, either cis or trans, if you are a person of color, whether you're Black, whether you're Asian, whether you're Middle Eastern, none of that matters. This is for anyone and everyone who is a chronic pain patient, chronically ill, disabled, elderly, who is struggling to get their opioids for either harm reduction purposes. Predominantly, though, as this group started, it was started as an advocacy/activist group for chronic pain patients. So, I mean, the underlying thing there is chronic pain, chronically ill, disabled, and elderly. And we've gone on to advocate for harm reduction as well, for people who have substance use disorders, looking for harm reduction as the means to that. And Beverly and Carrie and Claudia, I think, I'm not quite sure, but I think, but certainly I agree that people advocating for harm reduction and chronic pain patients advocating for our opioid medications back, we should be working together. Absolutely, 100% agree with that. It's basically boils down to having access to a type of medical care, is what it boils down to. Medical care that's been taken away. And the things that they're doing to us, chronic pain patients, chronically ill, disabled, elderly, what they're doing to us is leaking over into things like women's rights, as far as, you know, like, there's a lack of doctors. So a lot of people there's a lot of patients who are abandoned, chronically ill, chronic pain, disabled, elderly patients that are medically abandoned. Part of that is because a lot of doctors have been arrested for prescribing opiates. A lot of doctors have been arrested for prescribing hormones, not just for trans people, but also for elderly people who need hormones, because as you get older, your hormone levels drop and you need hormones. So doctors have been arrested for that. Doctors who have been arrested on a bunch of very vague legal issues surrounding women's reproductive rights when it comes to abortion care, which we've been seeing more and more stories of that popping up. And I can leave some video links to articles surrounding that issue in the description as well. So these things have made it difficult for doctors. Like, doctors are basically scared to take on patients, especially patients who are chronic pain patients, chronically ill patients, or disabled patients, especially those with conditions that are rare and complex. And I actually fall into that category. So the question pops up, is being pro-opioid use, is that left-wing or right-wing? Well, it's both. So first thing is those who are people of color, women, and LGBTQ are represented as far as advocating for harm reduction, safe access to opioids, and chronic pain, chronically ill, disabled, and elderly advocates and activists on their right to opioid pain medications. So in that sense, like, are we being inclusive? Yes. Yes. If you are a chronic pain patient, chronically ill patient, disabled patient, elderly patient, basically have medical need for opioid medications, whether that be for harm reduction purposes or a rare or complex or other chronic pain, chronically ill, debilitating conditions, yes, you are included. No one is pushing people out of the doctor-patient forum based on being LGBTQ, based on their sex, sexual orientation, or their ethnicity. Nobody's doing that. So, the second, so from an economic stance, is being pro-opioid left or right? Well, it's both. Economically speaking, being pro-opioid, it could go both. You could advocate for the use of opioids for medical purposes and harm reduction in a socialist society, non-capitalistic socialist society, or a capitalist society. You can do it doesn't matter what kind of society you have, you still there is a medical use for opioids in both treating chronic pain, chronic illness, disability, as well as harm reduction purposes. The reason why it is profit-based here in the United States is because the United States is a capitalist country. If we're a socialist country, we would still be advocating for the right to opioid medication, to treat medical conditions, as well as for harm reduction purposes. In fact, a lot of socialist-like countries are doing that for harm. They're actually offering medical-grade opioids as a safe supply as a response to the opiate epidemic. And it's been working as far as we can tell. There's been a significant reduction, like huge significant reduction in overdoses since they've been doing that. It's socialist countries that are doing that, by the way, not capitalist countries. But here in the United States, the only reason why it's a profit-based model is because the U.S. is a capitalist country. But being pro-opioid is, you could do that in a socialist country or society, you could do it in a capitalist country or society. It's both. Is being pro-opioid for medical and recreational use with harm reduction from a social stance, is that left-wing or right-wing? Well, it's let me just read it. For medical and recreational use with harm reduction for social stances, absolutely left-wing, as it advocates for more voting power, equal rights, and a voice for a group of people that generally don't have that. The moment someone says, I am better than you because I don't use opioids for pain, or because I don't use opioids, drugs in general, they are inherently otherizing and stigmatizing, which creates a class fracture of haves and have-nots, which is inherently hierarchical. So advocating for being pro-opioid, whether it be for medical use or recreational use for the purpose of harm reduction, is inherently leftist, because you are advocating for the voice of a group of people that generally don't have that voice. They don't have a seat at the table. They don't have much voting power. They don't really, they're not held to an equal standard. Another thing I would like to say, too, is that a lot of the times the left likes to talk about how we are the biggest jailer in the entire world. We put more people in jails and prisons than any other country in the world. You do realize that the largest percentage, the large majority of people sitting in our jails and prisons are there on drug charges. So expanding the prohibition to encompass things like opioids, and they're wanting to do it to benzodiazepines and meth-based medications for ADHD. And here's something, I read the recent DEA manuscript on what they're going to tell pharmaceutical companies how much of different types of medications they can manufacture per year. One of the things that they put on the list, and one of the things that you will get red flagged for as drug seeking, is hormones. So that's something that applies to trans people. You will get red flagged for seeking hormones. They are considering this a controlled substance, especially testosterone. Something to consider. So generally, overwhelmingly, being pro-opioid tends to be pretty leftist. Libertarians tend to be anti-prohibition. It's definitely liberal. It's anti-authoritarian. It's an anti-authoritarian position, whether you're doing it from the right wing or the left wing. But there are arguments for pro-opioid for medical and harm reduction use from across from left to center to right. But there's no argument that that is a liberal or libertarian position. And when I say liberal or libertarian position, I mean anti-authoritarian. That is how I'm using that word, anti-authoritarian. Not Ayn Rand or anything. Like there are libertarian Ayn Rand philosophy followers that do make like that group of people generally tends to be anti-prohibition based on the argument of free market. So but what I was saying, that's one of the reasons why. And so like if we're sitting there going like throwing the law at drug use over, like every time our knee-jerk reaction is to throw the law at things that we have some kind of moral hang-up about, that's more and more people that we're putting into jails and prisons, and thus we become we're never not going to be the world's biggest jailer or prisoner. I mean, because society keeps wanting to throw the law at everything it has some kind of hang up about. So like I said, they want to extend they don't want to just take opioid medications away for medical purposes, and not just medical harm reduction, definitely, but they don't want to just take opioids away for medical purposes. They also want to take benzodiazepines, meth-based medications for ADHD, and hormones, particularly testosterone. And I think that's dangerous. That's scary. So if you're on the left, you should probably support this. And I'm going to get into further reasons why as well, because it doesn't just stop there. Then there are left-wing, right-wing, centrist, libertarian, Ayn Rand type arguments for being pro-opioid. Regardless, being against prohibition is a liberal, meaning anti-authoritarian position, whether left-wing or right-wing. It is an anti-authoritarian position. Now, I watched the GOP presidential nomination debate, and I gotta say, if you are someone who advocates for harm reduction, or somebody who has a substance use disorder that needs harm reduction to happen, if you are a chronic pain patient, a chronically ill patient, a disabled patient, or elderly patient that needs opioids for medical purposes, I would say voting Republican is literally bad for your health. And to be honest with you, a lot of the people that are in the anti-opioid camp, like the people who are part of the PROP or PDMP, the people who came up with that, the people who came up with the prescribing guidelines, a lot of these people tend to be very far right wing. And the majority of the people who are anti-opioid in medical or harm reduction use are far right people. What I mean by far right is that they support things like the death penalty for the sales, distribution, and use. That was another thing I want to say that I forgot to say in the other video that I would like to say. When it came to what Caleb Alexander said about people dying, that he didn't care if people died to stop drug use overall. This is a very, very strange form of logic to me. So let me go over the logic again here is, in order to keep you from accidentally killing yourself, we have to kill you. How does that make sense? That doesn't make any sense to me. But that's not a Republican presidential candidate. That's one of the that's an epidemiologist from the Cato Institute that helped Andrew Kolodny and Anna Lembke and Jill Ballantyne, all these other people, make anti-opioid guidelines and legislation and policy that is in all the states across the U.S. That's the idea. That's literally one of the ideas they had. Well, a lot of these people, these GOP people running for candidacy for president, well, they seem to feel the same way, that the death penalty is the right way to go. They are pro-eugenics, pro-social Darwinism, pro-Akton T-4, pro-border, pro-traditionalism approach to medicine, like Anna Lembke saying we should go back to the way medicine was in the 1500s, or she actually said that chronic pain, like permanent damage to your body that causes pain that never stops 24/7, she said it's a spiritual issue and not a medical one. They are pro-police state, pro-surveillance state. They are anti-trans, anti-HRT. They are anti-women's rights in that they do not support women's reproductive rights to abortion, even in medical emergencies. They are against immigration. They are against the SSA and support cutting funding to the SSA or getting rid of it altogether. They are against ambulatory assistance devices, which was said by Caleb Alexander, especially paid for by Medicare and Medicaid. They are against Medicare and Medicaid. They are against disability income. They are against harm reduction. They are against food stamps, subsidized utilities and housing. Generally, overall, they tend to be people that are against socialized programs within the U.S., aside from the industrial military complex. I watched the GOP presidential nomination debate, and voting Republican would literally be bad for your health as a chronic pain patient, chronically ill patient, disabled patient, elderly patient, or a patient with a substance use disorder who wishes to seek treatment or advocates for harm reduction. And these anti-opioid people, like I said, like Andrew Kolodny, Jill Valentine, Anna Lembke, Caleb Alexander, they support these things. It's not just the people who were running on the GOP platform for the presidential nomination. It's people who created this anti-opioid propaganda, or all this anti-opioid stuff. The people who are responsible why you can't get your opioid medications as a chronic pain patient that is debilitated by your chronic pain condition are people that support all that stuff that I just said. That people on the GOP platform were talking about too. Another thing is that, like, a lot of people have turned to self-medicating. Well, look, if they're successful and they succeed in putting up a border and a wall, and it does how it works as intended, self-medication is off the table. Right now, the way that our medical system, I would say that trans people, especially like in states where HRT has been made illegal, trans people and chronic pain patients are in a very similar boat. You're really left with kind of three options. Suffer and, just kind of try to deal with it and suffer and live and breathe pain. Self-medicate by going to the deep web or the streets, or death. So if they put the wall up, that doesn't just keep people out, that keeps you locked in. But if they put a wall up and that works successfully as intended, they may not give you your medications. In fact, they may take more medications away. As I was saying, they want to take HRT away entirely. So if they are successful in doing that, and the wall, and it's successful in what they intend to do, the only options that are going to be available, because the self-medication won't be an option anymore. So then your options will become suffer or death. Self-medication off the table. That's something to consider. So I wish I had the screenshots. I have some, but I wanted to go over. I kind of wrote about this a little bit too, and the comment section of the Majority Report when they were covering the GOP presidential nomination platform, because of how often these things were brought up. By the way, if you want definition of the left and the right, well, with the left, traditionally, that came from the French Revolution. It's people who wanted a society based on egalitarianism or equality. People on the right side of the room, it was a town hall, wanted a society built based on hierarchy. And then, you have authoritarianism and anti-authoritarianism, and that's where you get your four-quadrant political compass, if in case you wanted to know. So there is a different aspect of looking at it through economic. You have economic left, economic right, and social issues left and right. But anyway, so I'll go through these screenshots here, and just read this to you, because it goes over a lot of what I was talking about. Might be controversial, but this is true, and I want people to be aware of this. One of the reasons why it's become harder to get healthcare is due to the opiate epidemic. Many chronic pain patients, chronically ill, disabled, and elderly patients have been medically abandoned. Most doctors are very reluctant to take on patients with high pain profile conditions, with conditions that are very rare and complicated, such as conditions like NTOS, CRPS, spinal adhesive arachniditis, and central nervous pain syndrome, to name some examples, literally just some. As someone who's become disabled by a very rare and complex chronic pain condition, I've run into this problem myself. Not only is it hard and seemingly impossible at times to actually get Medicaid or Medicare, it can take years fighting for disability to actually get it. During that time, most people lose their job, thus they lose their income and health insurance, on top of doctors being scared of the DEA raiding their homes for prescribing even low-dose opiate treatment to a chronic pain patient who has no other alternative to go to. Many of the medical facilities that they work for have stopped taking private payers. I personally was not even allowed to get my physical done because the hospital administration my primary care physician works for won't allow further treatment of the patient, or if the patient talks about a rare or complex chronic pain condition. They also said they would not do the blood test because they no longer take private payers, just people without health insurance. Many of the privately owned clinics only take on a small amount of patients to keep their prescribing scores down. The paying contracts they give now are more restrictive than a person on house arrest. These paying contracts are something you must sign whether you get prescribed medications or not. I could go into detail on them, but it will make this comment even longer than it already will be. All of the non-narcotic treatments available are extremely expensive, with or without insurance. One nerve block, trigger point injection, epidural, or Botox injection can cost upwards of $3,000. That's with insurance, and only yields about 4 hours of pain relief. Remember, we're talking about people who have become disabled due to their condition and can no longer work or find a job. One bottle of an SSRI, SNRI, tricyclic, or antidepressant that are sometimes used to treat pain can cost up to $800 without insurance. One bottle of gabapentin, Neurontin Lyrica, gabapentinoid anticonvulsants off-label prescribed for nerve pain, can cost $1,100. For some reason, hardly anyone wants to talk about the thousands of chronic pain patients, chronically ill, elderly, and disabled that are medically abandoned. The DEA has made examples out of doctors across the U.S. They have arrested many doctors dating back to 2016 as quote-unquote pill mills, without taking consideration that their prescribing rate may be high due to other factors. One such example was an anesthesiologist who was running a pain treatment facility and opiate use disorder clinic at the same time. She was the only pain clinic for a good distance, as well as an addiction treatment facility, and was the closest and only option for many people. The DEA held her and her family at gunpoint, took away her license, closed down her clinic, and sentenced her to prison as a drug trafficker. The sentence is long enough that she will be in prison for the rest of her life. All of her patients had nowhere else to go. Many of her patients that were chronically ill and elderly died. Many of the patients she treated for opiate use disorder lost access to their methadone or Suboxone. When the opioid prescribing guidelines first came out in 2016, the guidelines suggested 90 MME. Sometime around 2021, they lowered the recommended guideline down to 50 MME, which is the guideline that all except 2 states, I believe, adopted as state law. Since then, around 2022, the CDC realized this was causing harm to patients that were chronic pain patients, chronically ill and disabled. They ended up changing the guidelines back to 90 MME, but none of the states adopted back to the 90 MME and stayed at 50 MME. Much like states with anti-abortion laws or laws against prescribing HRT, which also contribute to this issue. Doctors are scared for their livelihoods to treat particular patients. Some anti-HRT laws in some states have been so aggressive. Elderly people whose hormone levels are dropping due to age can't get their hormones because they're still considered HRT. This puts those patients at higher risk for certain types of cancer or other health complications. I just read the DEA's proposal for pharmaceutical companies on yearly quotas for how many of certain drugs they can produce in that year. They're having pharmaceutical companies cut opioid medications down to only about 300 pills for the year of 2024. Other medications on that list that are being cut as far as production goes were antihistamines, amphetamine-based psychiatric meds, hormones, anti-anxiety meds, and many more. For many patients with rare, complex, high-pain profile conditions, many elderly people that I'm not used to seeing involved in this type of thing, are going to the street as they see it as the only option left. The patient abandonment is so bad right now. One of the top-selling drugs on the street are antibiotics. To trans people who can't get their hormones, some have resorted to get some have resorted to untrustworthy, uncontrolled, and unregulated sources off the internet for their hormones. I personally met and have helped several trans women get controlled and regulated estrogen, as the sources they were buying off the internet were causing them liver damage. I worked with social workers to get some people on to get them to HRT doctors across state lines. A particular person, and I know their skin and eyes were becoming jaundiced. With some of these very rare and complex high pain level conditions that lead to disability, some doctors have secretly gotten them access to medications they need to function and not die by helping them find a doctor in Mexico. This is hurting our medical system in so many ways. We have lost many doctors as they have either been arrested, had their license revoked, or many doctors have left the job as they cannot do their job due to laws that prevent them from doing their job. We have a serious shortage of doctors. Many doctors have engaged in early retirement because of all these laws that make it very, very difficult for them to do their job as well, because it's illegal to prescribe opioids to chronic pain patients, chronically ill and disabled elderly. It's illegal to give HRT. It's illegal to give ADHD medications. I mean, it's just a mess. This has left many chronic pain patients, chronically ill patients, elderly patients, and disabled patients without health care at all, and many have died. This has left many women without reproductive care. This has left many trans people without their gender reassignment care. None of this let's criminalize doctors and patients has fixed anything. It's only made things worse. The anti-HRT laws have caused damage to the trans and elderly patients. The anti-abortion laws have caused harm to women. The banning of pain medications has caused harm to chronic pain, chronically ill, elderly, disabled, and people with substance use disorders, and has not done anything to stop the fentanyl problem. For many of these patients, the streets have become the only option, which is the most dangerous because of all the fentanyl out there. We need harm reduction, and we need a safe supply from trusted medical care. For many abandoned patients, the only supply is unregulated, with no controls over the market on the streets or deep web. Because of this dire situation, as a chronic pain patient with a rare and complex debilitating chronic pain condition, I don't want them to close the border, because for many, although not exactly safe, it is the only supply available, even for things like antibiotics. Once you've been abandoned and you get an infection, getting antibiotics off the street or deep web may be the only option, and also the only one you can afford. As when you become disabled, it can be a very long time before you have an income or health insurance again. Even if you have health insurance, the streets or deep web may still be the only place you can find any treatment at all. I'm very concerned about the state of our healthcare in the US. I hope none of you get a rare, complex, debilitating, high-pain profile condition, because no one deserves to be treated like this. People with SUD, substance use disorder, don't deserve to be treated like this. Trans people, the elderly, disabled, women. Just no one, period, deserves to be treated like less than human. And that's that's what I have to say about this. So to anyone out there that approaches the people who run the doctor-patient forum, I think they're trying their hardest to be as bipartisan as possible, because chronic pain, chronic illness, disability, being disabled, elderly people, being a person of color, being a woman, being LGBTQ, like these things affect everyone. Anyone can become a chronic pain patient. Anyone can develop a substance use disorder. Anyone can become disabled. Anyone can become chronically ill. Everybody out there, regardless of who you are, needs access to medical treatment, medical care. Talked about the fentanyl issue. That's something that I was giving credit to Sam Cedar and her name slips my mind. It's like it keeps slipping my mind what her name is. Hold on, it'll come to me. It's not coming to me right now, but they have mentioned before, like they've talked about how like the police have said, oh, it'll like, oh my god, I opened a trunk and there's fentanyl in it, and you know, like automatically go into overdose mode, and it's like fentanyl does not absorb through your skin. Like fentanyl patches, like the the dermal absorption thing, that's a particular type of, like, you have to manufacture it that way. Fentanyl just doesn't absorb through your skin like that. Uh, it's very scary, especially being a gay man. And I may have to leave. Yeah, that's just me talking about the double whammy. Is that you know, like a lot of these right wing people, they don't like me because I'm a leftist, because I'm a homosexual, and on top of it, I'm also disabled from a chronic pain condition that is very rare and complex. So in that GOP presidential nominee debate, they continue talking about healthcare later on. Apparently, the Republican Party wants to make it possible to sue pharmaceutical companies, and they are using the COVID vaccines as the excuse, but apply that to all medications. And you're talking about something that's very, very, very dangerous. And I mean, we could lose a lot of medications. And Vivek actually said, quote, "We shouldn't be using medications. We should be promoting eating healthy and making healthy life choices." Now, one of the problems I have with that is there's nothing wrong with advocating for being healthy. There's nothing wrong with that. I got this condition from doing a physical manual labor job, not from eating unhealthy or making unhealthy life choices. That's not how this happened to me. And that's the thing that's not being taken into consideration, is that you could live as healthy as a lifestyle as humanly possible and accidents still happen, like car accidents. One of the things that they used to treat certain types of chronic pain conditions, like the epidurals can cause spinal adhesive arachniditis. So you could start off with something like having an inflammatory chronic pain condition like arthritis. You get an epidural to treat the inflammation. The epidural could cause spinal meningitis, and it can also cause spinal adhesive arachniditis, which is a chronic pain condition where the myelin sheath around your spinal column starts to calcify and solidify, basically turning your spine into solid bone, to my understanding, is what that condition is. It sounds horrifyingly painful, and I hope no one ever gets it. No one deserves to have that happen to them. This is something from Caleb Alexander, and this is, this is something that I did want to, this is so bizarre. In a study comparing 12 million commercial insurance beneficiaries with a household member who started a new prescription of opioids to 6 million beneficiaries with a household member who started a new prescription of non-opioid pain relievers, the 1-year risk of subsequent opioid use was 0.71% higher among individuals exposed to opioids through a household member's prescription. This is a really, really insignificant number. Like this is one of those things. It's like this has been used in medical documents and in academic work. Like this stuff gets pushed or given to policymakers. 0.71%. That's statistically really of no relevance. And I mean, what does that even really tell us? Is it almost really makes an argument for genetics over anything, really. I started thinking about this. Like, I know somebody who lives in a household full of people that are all on the same heart medication. It's a grandmother, a mother, and the son. They're all on the same heart medication. They all have heart failure, a heart disease. And for some reason, they're all on this exact same type, brand, and exact same heart medication. And what that is, it's interesting because that shows us a lot about like genetics and health conditions as we age. But, just because you find a health condition prevalent amongst a family, that doesn't mean that it's the medication. It could just simply be what you're looking at is genetics. I mean, duh. Like, I don't know that this really tells us anything, but, Caleb Alexander goes, aha, and just uses it to promote an anti-opioid narrative, even though this doesn't say anything about it doesn't. And I've talked about this already. And like I said, again, this is a thing that makes me think, like, am I losing my mind here? Or, between 2010 2019, opioid prescribing declined by 42.5%. Okay, so opioid prescribing for medical purposes is way down. Like, basically, it's impossible to get opioids prescribed to you anymore. Although fatal opioid overdoses has increased by 103%. It went up. Since we stopped prescribing opioids, the fatal opioid overdoses has gone up by 103%. And then he goes on to say these reductions in opioid prescribing averted an estimate 9,600 people's deaths. How do you figure that? It's gone up, not down, up, 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 up. It increased by 103%. It wasn't at 103% and increased by like 0.01%. It was at 1% and increased by 103%. And he comes to the conclusion, oh, because we stopped prescribing opioid medications, then 9,600 people have been saved. I don't know how you figure that. That's nonsense. That's nonsense. That doesn't make sense. Neither did the other thing. The 0.71%. If it's saying, if you live in a household with 15 people, let's say one of them develops a chronic pain condition, who knows how, and they're prescribed opioid medications for the pain. It's saying all the other 14 members of the house, if they develop a chronic pain condition, then they have a 0.71% likelihood of also being prescribed an opioid pain medication for their chronic pain. Well, so what? What does that even... What does that have to do with anything at all? That doesn't tell us anything. That's pretty much useless information. Like, you cannot come to a conclusion with that information at all. But this guy is producing studies that are extremely biased, and policies are being based off of it. You know, it's just what's going on. But now on the whole left-right thing, please do not make the advocacy and activism to get access to opioid medications for medical care. Now, be that medical care for pain. There's illnesses that we use opioids for, not for pain relief, but for other purposes. For that, or even as a form of safe supply for somebody with a substance use disorder. This could be Suboxone or methadone. Please do not make this politically divisive. The fact is that when a cause is supported across the political spectrum, it has a much higher likelihood to succeed. Because it's not just the Democrats that are getting letters from angry chronic pain patients and people with substance use disorders. Or it's not just libertarians, there's a very few amount, but there's some up there. Libertarians receiving letters from their angry constituent chronic pain patients, elderly people, and people with substance use disorders. It's not just Republicans receiving those letters either, it's every single one. So in the House and the Senate, when they go to conjure a meeting and you know, they keep getting these letters, they stand up and they say, well, we keep getting this concern, these letters, people want access to their opioids back for medical purposes, be it to used to treat substance use disorder, or be it used to treat a medical condition like chronic pain or chronic illness. People want these back. We need access either for safe supply or for medical reasons. And not a single person in the House or the Senate can say that they're not receiving those letters. They all stand up and say, yeah, everyone's doing this. All of our constituents are. This is not being, there's no political divide. Like, America's not divided on this. The people that taking opioid medications away is affected by, they're all saying this is a terrible thing, please bring them back across the board. It has a much higher likelihood of succeeding when that happens. Being politically divisive for the sake of being politically divisive is not being helpful. So are there people within the doctor-patient forum that probably subscribe to political ideas that you don't? Probably. But we don't need to discuss that matter. If you want to discuss what's happening in the Middle East, that's a completely different conversation than talking about what's happening to chronic pain patients, people with substance use disorders, as far as having access to medications to manage and control pain, or having access to a safe supply or medications for withdrawals for harm reduction purposes. Either way. All those other political issues, they're not about this. This is about chronic pain patients, harm reduction, chronically ill, disabled, elderly, and people with a substance use disorder and harm reduction. That's what this is about. So if you bring up other political issues and you don't like what you hear, that's on you. It's a completely different issue. Don't equate it to the entirety that is the doctor-patient forum and the movement that is trying to get access to medical opioids back for various reasons and purposes. Don't do that. That's not helpful. But I would say, overwhelmingly, the people who are anti-opioid are on the right, and they tend to be far right. I mean, the idea that we should have healthcare, which is what Anna Lembke said, healthcare like we had back in the 1500s, that's traditionalism, that's conservatism, that's far right. You know, that's crazy. I don't know why anyone would want to do that. Or the idea of saying that chronic pain is not a medical issue, it's a spiritual issue that you should go and see your pastor, your preacher, or whatever for. Again, that's very far right. That's very traditional. It's very conservative. That's bizarre. It's pretty much science denialism. Vivek saying we give the ability to sue all these pharmaceutical companies, so anytime, I mean, at that point, we would be looking at banning a lot of medications that have saved people's lives. Like, just because it doesn't work for you doesn't mean that there's somebody out there that it hasn't been a game changer for them. This is all very dangerous stuff. And then, like, being that it's HRT has been taken away from many people, and access to pain relief has been taken away from many people. For a lot of people that need HRT or pain meds, about the only thing they have right now is an uncontrolled, unregulated market, which is not the best or the greatest. We want the controlled and regulated market back. This is a capitalist country. It's going to be a for-profit. We don't live in a socialist country. We live in a capitalist country. So, but the thing is the controls and regulations for dose and purity and all that, it's not there. So you go to black market, the deep web, the street to get self-medicated. I mean, that's the only option. It's not the best, but if that's your only option, that's what a lot of people do. And what I mentioned earlier, like, I have seen people, like, as old as my grandparents go to the street, and the parts of the street that they would have to go to be able to self-medicate, I have never seen people like my grandparents in those areas, and now you do. It's wild. This is unbelievable. But yeah, if they put up the wall, I mean, which the wall is based, we all know that's based on fear of immigration, racism, etc., etc. You won't be able to self-medicate anymore. A lot of the anti-opioid people, Caleb Alexander, he's pro-eugenics, pro-social Darwinist approach to chronic pain, chronic illness, and disability. That's sick. That's Hitler stuff. Andrew Kolodny, same thing. Andrew Kolodny has said an entire generation of people need to die in order to see his greatness. So basically, screw you. Like, all of these people who have used opioids to manage their pain, they all need to die. And has never conceded the thought once that that's not the issue. The issue is that the alternatives to opioids are nowhere near as effective. Never conceded that idea once. And the fact of the matter is a lot of people in wealthier communities that can jump through all the little hoops at the pain management clinics like a little poodle, they have the money to expend. They're more likely to get opioids prescribed to them. So you still get them if you're rich enough, or you can go to another country and get them, but not. It's mostly affecting middle class below. So a lot of the anti-opioid stuff is coming from the right, far right. A lot of it is very far right, very far right. And I would say being pro-opioid, regardless for harm reduction or for medical use, either way, it's really technically medical use, is leftist. It's socially leftist. Because we live in a capitalist country, I don't know that you're going to see social, like, we would have to get socialized medicine to argue for socialized access to opioids. We don't have that. So, no, it's leftist. It is. And I think everyone is welcome. Everyone should be welcome, regardless of your creed. I mean, this is for anyone who needs opioids, whether it be for safe supply, harm reduction, chronic pain, chronic illness, disability. It's for anyone, whether you're LGBTQ or a person of color. And I can't go through the list of all the different colors there are of people. It's like, who cares? Human beings are human beings. People exist. Yeah. So let me know what you think in the comments section. I will leave links to videos in the description, and I'm out.